So a question that came in, the easiest way to sterilize something is to expose it to UV. Is that not possible so that the mask supply that we have can be reused without spreading the disease?
Yeah, again, great question. One that we started exploring weeks ago. Again, well before supplies were starting to come in more frequently. But we looked at all of the different options that were being considered by the FDA and the CDC. The first one was definitely the ultraviolet light. And there are machines that you can buy, you can Google them. Hospitals use them. We actually use UV decontamination routinely in the hospital to decontaminate equipment or instruments or things of that nature. But we had never ever used them to decontaminate mass. But it was being done by certain institutions. Another was, and this is what Stanford Medical Center, what they implemented early on. I think they've kind of moved away from this. But they were taking their mask and putting them in essentially an oven, heating it to 170 degrees and baking them in there for 30 minutes, which the science had indicated that was sufficient to kill the virus. And they did the testing pre and post to confirm it. But that methodology was never adopted or approved by the FDA or the CDC. The third one, which has just now been approved by the FDA, under the emergency use authorization, is the aerosolized hydrogen peroxide. So everybody has a bottle of peroxide in their medicine cabinet. When we get a cut, we pour it, fizzes up and everything, disinfects. So there is a company called Battelle that created the Battelle decontamination system that takes that hydrogen peroxide and turns it into an aerosol that has proven to effectively clean N95 masks. So the FDA, again, has just given approval for hospitals to use this to decontaminate N95 masks or equivalent. The federal government just awarded a $400 million contract to Battelle that will now, starting tomorrow, for us, allow us to take our used N95 masks and ship them to Battelle, who will decontaminate them for free. Free to us because the federal government is paying it through this contract. But this company is standing up a number of decontamination sites now in California. Before, it wasn't available to us here. But starting tomorrow, there will be a site in Fremont and Burbank. And I don't know which site that we would use, but they can clean up to 80,000 masks per day.
Wow.
Yeah.
So do we get our masks back?
We don't know that
Or
yet.
other
So
people's masks?
again, our mask subcommittee is exploring our infection prevention staff, Dr. Boken, our epidemiologist, all exploring what would happen. Most likely, I mean, you would think that, okay, if it's a completely decontaminated mask, does it matter if you get back your own Quia Delta mask or you get some other hospitals? I don't know. I don't know how that's going to work yet. So, but definitely, an important way for hospitals to again extend the useful life. And we've been told that these can be decontaminated up to 20 times without degrading the respiratory nature of it, the respirators that are built into the mask.